Hello, everybody, and welcome to the first in our webinar series, Supporting Our Children During a Global Pandemic, focusing on the mental health needs of our youth. My name is Jamie Stormer, and I am the Director of Children's Outpatient for Meridian Behavioral Healthcare, our Alachua County office. Today, we're going to spend some time talking about the mental health of our children, along with some strategies to talk to children about the coronavirus pandemic, and signs of difficulty that you as parents can watch out for as this virus progresses. And I will offer some strategies to help your children learn to cope with all of the changes that have occurred. So let's start by talking about children's mental health in general. We know that children and adolescents have experienced significant changes as a result of this COVID-19 virus, including changes in their day-to-day lifestyle, including closures of schools and distance learning being introduced, cancellations of milestone celebrations like birthdays and graduations and proms and all of those rites of passages that kids tend to look forward to. They have lost their ability to participate in many sports activities and other extracurricular activities. They're also not able to see family and friends that they are typically used to seeing on a daily basis, or at least a regular basis. They may have developed some worries about getting COVID-19 and their family members getting COVID-19. It's definitely something that is weighing on everybody's mind. Children, as well as adults and families in general, are experiencing many economic hardships and less access to care, as we've seen offices closing to take precautions for this virus. And although some of those may be opening up, we still see some limitations in access to care for children and families in general. First and foremost, it's really important that as parents, we are taking the time to talk to our children about the pandemic. We want to be open to questions as children, whether they are young children or school-age children or adolescents, they're going to have questions, and we want to encourage them to ask. We want to take their concerns seriously, even if they seem small or silly to us. When we're talking to children, we want to make sure that we are sticking to the facts and only the facts that we know at this time. Remember that it's okay to say, I don't know. Whether we're adults or we're younger, we're all learning about this virus day to day, and there are still things that we don't know. So it's important to let them know that we may not know anything about this at this time, but you as their parent are working to gain as much information as you can, and you will help them along. We want to model that it's okay for us to have uncertainty, and we can get through that. When we are explaining aspects of the virus and precautions that we're taking, we want to keep explanations developmentally appropriate for our children. Make sure, especially for young children, we are sticking to very limited information, simple information, and reassuring them that adults are there to keep them healthy. We can talk about some facts about the virus, that yes, there is a virus out there and some people are getting sick, but we want to be there and take precautions and keep everybody safe, because reassurance is that key to avoiding excess anxiety for our young children. As children get a little bit older, we can provide them with a little bit more information. So for upper elementary or middle school children, they might tend to ask more questions than younger children, questions that you may be able to answer with a little bit more facts. So provide that information for them while separating some of the rumors from what is reality. So discuss steps that are taken to avoid spreading the virus, but try to avoid furthering myths and stigma that are coming along with this virus. In terms of talking to upper middle or high school students or children, you can discuss the pandemic more in depth with them. They are able to handle it a little bit better. So allow them to look at reputable sources for information and facts. or provide fact sheets for them, allow them to view some of the graphs that we've seen coming out about daily numbers and how to flatten the curve. Also give them a little bit of ownership in day-to-day activities at home, and we'll talk a little bit more about that later. Again, we want to reassure our children while we're talking to them. Children are going to worry that they're going to get sick, so we need to assure them of our role in helping them through this in the most safe way possible. Share how you're dealing with your own anxiety and what things are helping you calm yourself when you're feeling overwhelmed. We want to focus on safety. Again, those precautions that everybody is trying to put into place with social distancing or wearing masks or face coverings in public, and letting them be involved in that safety planning. Update children as you learn more. It will help them stick again to those facts. And remain calm. Children are tuned into their parents and they feel what their parents feel. So it's important that if you're anxious, you wait till a time where you're calm to begin talking to them and answering their questions. An important aspect to consider when talking to children as well is avoiding blame. We want to make sure that we are reducing our blame of groups that maybe people are assuming are more implicated in spreading this virus. So whether that be a race or a cultural group, or individuals who are more willing to wear masks and social distance than others, we don't want to be spreading rumors that those groups are the reason that this virus is spreading. We want to be accepting of all and model that for our children. Remember when having these conversations with your kids to take cues from your child. Allow them to share the things that they've heard and what their thoughts are. I'm going to follow their lead in these conversations to really get an idea of what they're experiencing. Avoid furthering any anxiety that they're currently having by dispelling myths and rumors, talking to them about what is true and what is not, because often kids and their imaginations can get fixated on some of those rumors, especially if they seem a little scary. We want to acknowledge anxiety and find ways to cope with that. So it's normal for anybody, whether it be an adult or a child, to feel anxiety during this time. Everything is uncertain and developments are changing every day. So parents and adults are not immune to this. And we can acknowledge that and talk to our children and tell them that we feel anxious too. But again, take time to calm down if you're feeling that anxiety in the moment before talking to your child. It's important to explain social distancing. A lot of children may not understand, why are we staying away from grandma and grandpa, or why can't we see our friends that we're extremely close with and they're our best friend, why can't we see them? So we want to help them understand what social distancing is and why we're doing it. So explaining that scientists and medical professionals are recommending that we follow the guidelines of the CDC, and that social distancing means that we're staying away from people who don't live in our home for some time, so that way we can reduce the spread of the virus and reduce the number of people who get sick. So for older children, again, showing them the charts and the graphs about flattening the curve and helping them really get a better understanding of how social distancing can help with battling this virus. And we want to model positive practices for our kids. That means our daily hygiene practices, washing our hands at a regular basis, washing them for 20 seconds. For younger children, maybe teaching them a song or another strategy to help them understand what 20 seconds is. Practicing, reminding them to sneeze into tissues, coughing into tissues or their elbow, maintaining cleanliness, avoiding handshaking, hugs for now, trying maybe air hugs and high fives from a distance, air high fives. So this can be a little bit challenging, especially when we teach young children that it's important that we greet somebody with a handshake or a hug. So it might take a little bit of time to teach them this new way of greeting others. Another thing to consider is that we really should have a good understanding about the symptoms of COVID-19. So the CDC has come out with a list of potential signs and symptoms of COVID-19, including fever, chills, coughing, shortness of breath, difficulty breathing, fatigue, body aches, headaches, loss of taste or smell, sore throat, and many others, and the list continues to grow as we learn more about this virus. But it's, not only understanding the symptoms of COVID-19, but understanding that they vary widely. Some individuals get a very mild case, others get very severe cases, and there are different combinations of symptoms, so it's very hard to predict. Another challenge is that some of the symptoms of COVID-19 are also present in other diagnosable conditions or illnesses. So for example, here we see anxiety is one of those that has overlapping symptoms. So you might see with COVID and anxiety some chills and shaking and sweating and chest pain, hot flashes, and shortness of breath. So it's important to be aware that just because somebody's experiencing these symptoms, more information is needed to make a diagnosis. So if you're in doubt or need some additional help, make sure you contact a medical professional before making that assumption that symptoms are related to COVID-19, but at the same time, before making that assumption that the symptoms are not related to COVID-19. Sometimes it's a challenge for children to talk about their feelings, and sometimes it's also difficult for adults to talk to children about their feelings. We are all experiencing challenging emotions that we are working to try to figure out, but for children, they may need us to check in with them a little bit more. So it's important to validate your children. Let them know that you're feeling what they're feeling and they're not alone. Whether it be you yourself or their friends or their siblings or other family members, we're all at one point going to experience the same emotions and uncertainty. So you want to empower your children to get involved with problem solving and maybe asking them some open-ended questions to kind of get them in that mindset of how to problem solve what they're experiencing. So asking questions such as, what did you learn about today? What was something interesting that you heard about, to try to get at some of the positive things that happened for them and take some of that focus away from the negative, scary things. You might talk about the fun things that they did today. What are they looking forward to tomorrow? What was it? And then also talking about what were the tough parts of today. So then brainstorming maybe some ways that they can make some changes, or what can they do differently for tomorrow to make it a better day. Again, we want to provide that reassurance that you as their parent or their family member are there to help them, and you are going to do everything that you can to assist them. And you want to ask what your child is feeling. Some children may or may not know how to identify their feelings or name them or talk about what they're feeling, and that may be due to a developmental delay or their developmental level, or maybe they just have difficulty processing what they're feeling. So helping them label some emotions, kind of describe what you're seeing in your child that is indicating that they might be having a certain emotion, and give examples of how you felt the same way, and maybe some examples of how you have tried to overcome some challenging emotions, especially those like sadness and anger and frustration. A word of caution would be to try to avoid talking to your children about COVID-19 or other scary things around bedtime. You want to look for a calm moment during the day to bring up things that might cause extra worries for children. So we also want to avoid talking about COVID-19 or other challenging events when someone is upset, because that tends to not be as helpful to the problem solving process. We want to help identify feelings and talk about some solutions. We want to make sure that everybody's calm, everybody's well rested, and allowing them to process the information that they're going to be given. So especially for young children, you may have to have some strategies that make it more concrete and easier to start the conversation about what they're feeling. Again, some children, it's easier to talk to others about their emotions than others. So it's important to meet your child where they're at when starting these conversations. So the first strategy that you could potentially use is a feelings chart, as you will see on this screen. You can pick one that represents your child and ask them to look at the chart and identify how they felt today, or in general, just talking about a hypothetical situation and how they may have felt, to kind of get an idea of how they are identifying their emotions and can they understand or identify what they're feeling in the moment. Some other strategies you could use would be to play a game with your child. So one idea would be a feelings memory. So finding pictures of individuals from magazines or books or off the internet of people exhibiting different facial expressions that represent different emotions like happiness and fear and feeling lonely or proud or frustrated, all of the emotions that we want children to be able to identify. So you could make 2 copies of them, put them face down on the floor or on the table, and take turns with your child trying to make matches. And when you do make matches, make sure you talk about those emotions. So asking your child, when was the time that he or she felt that way? Or what makes him feel, he or she feel that way? Or what does he or she do when they start feeling that way, and getting that conversation going. Another idea might be beginning feeling scavenger hunts. So where you make a list of emotions that you want your child to find throughout your home, whether that be in magazines or in pictures or other media outlets, just finding different feelings as long as they're being safe. So they would obtain those emotions, the emotion cards. You could also print them out and hide them around your home, so that the child doesn't have to do the finding of the exact emotions themselves. And then you can make a list and say, I want you to go find these throughout our homes. And when he or she finds them, ask them to name a time when they felt that way or what makes them feel that way. And it's important that you share in that activity as well, and identifying sometimes where you may have felt some of the same things, so that they can relate to you. Drawing or writing about feelings is also a way for maybe some older kids to start really processing what they're feeling and identifying what they're feeling, even if they can't have that conversation about it right now. So having them draw a picture or write about how they're feeling and then talking about it after. So these can be fun activities, but also show your child that you are there for them and want to be involved and help them through what they're feeling. As parents, you know your children better than anyone else, so it's important to look for some signs that children might be struggling with their response to the COVID-19 virus. So things you want to look out for would be increased anxiety and depression, so sadness, excessive worries. We're going to talk about more of the specific signs to look for with anxiety and depression in just a few slides. But other things you might want to look out for would be emotional outbursts. So your child exhibiting temper tantrum behaviors or meltdowns, difficulty regulating their emotions, maybe having more irritability or acting out behaviors. Also looking out for any suicidal thoughts, indications of suicidal thoughts, or any behaviors that indicate that your child is experiencing suicidal thoughts. So those could be maybe they're becoming more isolated, where they're staying in their room more, any changes in eating or sleeping patterns, significant mood changes, behavior changes, when they are in school, declining grades, is there indication of drug or alcohol use? Maybe they're talking about feeling hopeless or helpless, or maybe they're feeling like they're being a burden, or outright comments about wanting to die, or when you're doing activities like writing and drawing, if there are themes in there that indicate that they're thinking about suicide. It's important to monitor your child's behavior and activity and seek help if any of these are occurring. Don't be afraid to ask your child outright if you're concerned, because you are there to help them and keep them safe. So sometimes we need to ask those questions directly. In terms of behavioral changes, you may also see some unhealthy behaviors, again, mentioning the use of alcohol or substances. So we want to watch out for that. Or also, especially for younger children, you might start seeing them regressing a little bit, exhibiting behaviors that might be typical of a child that's younger than their current age. Some of these being having accidents, thumb sucking, bedwetting, or again, other behaviors that are characteristic of children that are a little bit younger than their age. Some other things to look out for would be acting out, any crying or irritation. Any of these could be indications that your child is having some difficulty coping. Again, if you are having concerns about your child's response or someone else in your family, please seek a mental health professional to get some assistance and make sure that your child and your family are safe. Again, everyone responds differently to a crisis, and this is definitely a long-term crisis and something that is sticking around for a while. So you might see some signs at different times. You can see different combinations of signs for different children. So pay attention to those behaviors and try to get your kids to talk about them as much as possible. And again, if needed, ask them directly to tell you about what is going on with them. So as I mentioned before, we want to pay attention to specific signs of depression and also anxiety. So in terms of depression, watching out for withdrawal. So this is often one of the first signs that is noticed, where a child is no longer interested in activities that he or she used to be interested in. Maybe they're not anticipating events. It can be difficult during these times to anticipate events, but in general, looking out for, if something's coming up and they just don't seem too interested or to care so much, that could be a warning sign. You might see some changes in mood, especially with sadness or irritability. As things start opening up, watching out for these changes in mood to persist as we try and get more of a sense of normalcy. Looking out for changes in weight, changes in behavior. So maybe they're sleeping, at odd times during the day and not sleeping at night. They might be, sleeping longer hours or shorter hours. So watching those sleep patterns, and then looking at their energy level. Maybe it's a little bit more slow than it normally is. Maybe they have less of an appetite. So those can all be signs that there's some difficulty there. And you might also see some changes in thoughts. So they might be having those negative thoughts of themselves. Maybe they're thinking they're not good enough, they don't look good enough, having a very negative assessment of their personality. And then again, those thoughts or attempts to harm themselves are very big warning signs that your child needs some help. In terms of anxiety, children may express to you directly, I'm feeling anxious, or I'm feeling worried about COVID-19, or they might tell you that something else is worrying them. So it might be that they're staying home. It might be that they can't see grandma and grandpa. Maybe they're wondering, what's going to happen when school starts. Is school going to start? Anxiety, even if it's not being portrayed as directly related to COVID-19, can all be related. So you might see a lot of reassurance seeking in your children. So they might be asking if everything's okay. If you go to work and during the day and you're leaving home, they might say, are you going to be okay? What time are you coming home? Am I going to be safe? Are you going to get sick? So they might be asking lots of questions and having difficulty separating from you as caregivers because they're looking for that reassurance that things are going to be okay. You might see them experiencing some physical symptoms like headaches or stomach aches that are more related to anxiety than an actual medical condition. Again, moodiness and irritability or throwing a temper tantrum and difficulty sleeping are all common signs of anxious behavior. Children want to know that you are doing everything that you can and that everything is going to be okay. And it's hard for us to know at this time what's going to happen. So make sure that you are providing that reassurance for your child, that you're doing everything that you can to keep them safe and reviewing the steps that you're taking to do so. That will go a long way in putting some of their anxiety at ease. So as we mentioned before, a lot has changed because of the COVID-19 virus. So sometimes it's difficult to know how to cope or how to help your children cope with some of the disappointments that have happened to them. So it's important to help you stay with them and be with them to help them work through some of this disappointment. And you can do that first and foremost by listening and acknowledging what they're going through. So avoid trying to fix it. Unfortunately, as parents, you want to fix things for your child. You don't want to see them struggling. You don't want to see them hurt, but there's no fixing this situation at this time. So talking to your child and find out specifically what they're most disappointed with. And each child might have a different reason for being disappointed about an event. And you want to acknowledge their frustration while avoiding any judgment of the things that they're mentioning to you. Keep in mind that things that are small to children, or I'm sorry, things that are big to children are small to adults. So it might seem to you that they're getting upset over something seemingly small, but that's one way that they're processing the information. So be there to show them support and provide reassurance and understand that anything that they're disappointed about is probably pretty typical for children to be experiencing. So try not to judge or make assumptions of the things that they're going through. You also want to provide perspective while validating the worries. So again, we're acknowledging this is a frustrating time. Let them know like you're feeling this too sometimes, and avoiding giving them a timeline, because we don't know what the timeline for this virus is. So providing that reassurance, yes, someday things hopefully will get back to normal. We just don't know when that is. And share your experiences with uncertainty and big changes. So talking about a time where you had to deal with the uncertainty of a move, or graduating from school, things like that. So those big changes that you've had to deal with and work through, and how you were able to rise to that occasion. You want to work with your child on seeking solutions. So looking for alternative activities for those milestone events. So we've seen in the news how people are doing parades for birthday celebrations, or Zoom parties, or other distancing activities that they've been creative and come up with. So talk to your children about what alternative activities you'd feel comfortable with them doing, and help them plan and implement those. Allow them to provide them some time to talk with their friends especially about how that they're feeling. So you may not be able to meet in person, but is there a time where you can have, a meeting online, or get together at an outdoor activity where you can stay at least at 6 feet apart, but encouraging them to talk to their friends about their feelings, so that they can see that they're not alone. You want to help give them a sense of control as well. So especially for those older children, allowing them to plan activities for the family. So maybe like planning a schedule of the day, or what the family is going to have for meals, or implementing family game nights where the children are able to choose some of the activities that you're doing, to give them a little bit of sense of control. And providing some of your own coping strategies, so things that you might do to help yourself calm down, whether that be having a conversation with somebody, or writing, or taking some time to read, or even cooking or baking. So share those activities with your children, and remind them of some things that they have done in the past that they have overcome. So, for example, many kids have experienced switching schools, or making a move, making new friends, starting a new activity, like learning a new instrument, taking a test. So these are all things that, even though they look different, they've had to work through them, and remind them of what they've done to overcome some of these obstacles, and how you're confident that you believe that they will be able to do the same thing in meeting the challenges of COVID-19. In terms of helping your child, if you notice that they're showing a sign of difficulty, there are some things that you can do, and it's important first and foremost to help them stay active. You want to help them engage the body and the mind by doing things like exercising, or reading, learning something new, engaging in projects or crafts. Something that's going to give them a sense of accomplishment and a sense of purpose. And making it fun and social is definitely going to be a benefit from that for them, for their own mental well-being. Help them with perspective taking and avoiding exaggerations or obsessions. Don't focus on just negative, don't focus on the positive, and try to redirect those thoughts of this is never going to end, because we're hopefully confident that this will end, or we will develop new normals, and we'll get through all of this together. Helping them tolerate uncertainty, letting them know that you believe in their ability to manage this uncertainty and model that for them. Challenge any negative thoughts that they develop. So focusing on the negative can often lead to increased depression or anxiety, and feeling like things that are overwhelming and not able to be handled. So help them evaluate, with their negative thought of this is never going to end. What is the evidence for this? What is the evidence against this? So, talking about how, scientists and medical professionals are working every day to find treatments and vaccines that will help us get through this, and so we can get back to our typical day-to-day. So challenging those thoughts, and helping them learn to do that on their own as well. It's important to make plans, to help your child feel like they're engaged, whether that be online activities, learning new skills, things that are going to interest them, things that they can do by themselves, or with friends in a socially distant way. Making plans for the near future, and also setting goals, again, to give them that sense of accomplishment. Focusing on things that they want to do for themselves or others. So it might be, again, learning a new skill, but it could also be, making meals for those who are less fortunate, or, writing letters, expressing gratitude. And again, focusing on gratitude, making a list of things that they're grateful for, and some strategies to express this. And finally, if you're noticing that your child is having a special difficulty with coping with COVID-19, please seek treatment if necessary. As I mentioned before, it's really important to show your support for your child, and part of doing this is setting and sticking to routines. Children need predictability. It helps them reduce anxiety. It gives them an understanding of what's coming next. So it's important to create a routine, create a schedule where you're structuring times to wake up, structuring meal times, structuring learning times, different activities and bedtime, maybe mimicking like a school day or a camp day, if they're not able to attend these activities, but making sure that they know what to expect, what's coming each day, and changing activities at a predictable level. Allowing them to get involved in new routines and involving yourself as well. So that maybe you as a family start again a family game night, or you do walks in the evening or something like that. That you are all being safe. You're getting out of the house and you're doing something to engage everybody's brain. Make sure you're limiting news. Sometimes too much news can lead to other worries, and it can cause some negative beliefs about what is happening and the safety of children. So spend some time, turn off that news, spend some time together as family, and engage in other activities. Avoid giving too much information, especially for young children. Sometimes they're just not able to understand, and giving too much information increases the likelihood of a negative reaction. Make sure that you're allowing your children to socialize. This is a big part of development, socialization, so it's important to stay connected. It helps them regulate their mood, and gives them other activities throughout the day. So make sure you're monitoring activities, especially if they're using online games or social media. Make sure you know who your children are talking to, set limits, discuss potential topics of conversation ahead of time to help facilitate positive interactions, and allow them to talk to not only family members but also friends. Again, plan for the future, the near future. Any activities that you can think of for when things are opening a little bit more, or as we're moving through the summer, activities that you can do outdoors, and assign tasks to your kids to get ready for some of these events. And of course, check in periodically with your child so that they can discuss concerns with you, and make sure that they know that you're accessible for them. One thing that's often overlooked when we are caring for others is caring for ourselves. So it's important to take care of your own reactions and your own needs. You're not going to be as effective at meeting the needs of your family or others who are looking to you for support. So always remember that your feelings are important, and please don't push any of your reactions or your negative feelings away. Do some of the same things that you'd be asking your children to do. Seek help, seek communication, talk to people about how you're feeling. In particular, you want to pay attention to any inability to stop thinking about the crisis that we're facing, an inability to make decisions, an inability to express yourself, any chronic fatigue, any pains that you're having like stomach aches and headaches, changes in appetite and sleeping, excessive worries, feeling numb, changes in your mood. These, again, just like with our children, are all indications that you may need some help through what you're experiencing. It's important for everybody to engage in self-care, whether that be physical, like healthy eating, exercising, limiting the use of alcohol and substances, or emotional self-care, like being aware of your own limitations and reactions, forgiving yourself for having reactions, and reminding yourself that it is okay to feel stress. and also engaging in some social self-care. So engaging in social activities, maintaining a daily routine, connecting with family and friends as much as you can, whether that be over the phone or any video chatting. Make sure you talk to others about your feeling and seek help when needed. It's important also to manage any anger and frustration that you're experiencing. Everyone feels anger, especially when we're dealing with this pandemic that comes with a whole new set of frustrations and challenges. Acknowledge that we are feeling angry. Everyone is feeling it. Recognize it and give yourself time to calm down before dealing with the day-to-day stressors that come with raising children or maintaining relationships. Even if it's 5 minutes, to give yourself some time to calm down, take care of yourself, be by yourself, take that time for your own ability to recharge. And celebrate some of your successes each day, no matter how small it is, whether it be a success at work, finishing a project, or you made it through dinner without the kids fighting with each other. Find those successes, identify them, and spend some time focusing on them. And remember that you can help your children by taking care of yourself. And part of that is staying up to date on what's going on, but limiting exposure, so that way you're not doing any COVID overload. Sticking to facts only and focusing on positives. Maintaining your own health, whether that be mental health, physical health, emotional health. Make sure that you are taking care of yourself. Again, take some time to relax, even if it's 5 minutes a day. Pay attention to your body and your feelings. Recognize your signs of stress. Where do you feel it? How do you know you're stressed? Try to identify some of those so that way you can be more mindful and spend some time connecting with others. Again, here's some reminders of coping with COVID-19. You can take breaks from the news, unwind, and set those goals and priorities, not just for your children, for yourself as well. Take care of your body. That can be something that you do with your children and your family. Again, doing family exercises, going outside to walk around, playing games together. Make sure that you're connecting and focusing only on the facts. And remember, if you're finding that for your children or yourself that the responses, you're having difficulty with coping with COVID-19 or any other life stressors, remember that Meridian is open. We provide individual and group therapy. We can provide these services in person, telehealth, and we also have crisis response. So, in case of an emergency or a crisis, please call our mobile response teams, either through Meridian or the Alachua County Crisis Center, or call our Access Center for a regular appointment to have some mental health services. And here you'll see some resources for Alachua County, including our resource centers through Library Partnership, the SWAG Family Resource Center and Cone Park Library Center, United Way of North Florida to help with some concrete needs, the Early Learning Coalition, Alachua County Public Schools, Fiddlers, and the National Alliance on Mental Illness in Gainesville. So these are all resources you can go to get some more information about different resources and services in the community. In the Tri-County area, please contact the Tri-County Community Resource Center, the Early Learning Coalition, county libraries, and Florida Diagnostic Learning System as well. And in our northern counties, there's United Way, there's Northeast Florida Community Action Agency, the Early Learning Coalition, and Fiddlers again. In general, resources to find some other mental health illness, mental health resources. We have NAMI, the Centers for Disease Control, and the National Institute of Mental Health. And here you'll also see our suicide prevention lifeline, 1-800-273-TALK. If you are experiencing a crisis, please reach out to get some assistance. We are here and we would like to help. In our next webinar, we're going to spend some time talking about the differences between addressing the pandemic with young children and older children. We're going to talk about some activities that you can do with your children at home. And we're going to talk about how to incorporate academic skills during your time at home, as well as some coping strategies for children. And please join us on September 2nd. We're going to have, for our final webinar in the series, we're going to have a Q&A with clinicians. So if you have specific questions, please email Denise Thomas at denise_thomas@mbhci.org. Please email her any questions that you have that clinicians can answer. And again, thank you everyone for joining, and I wish everyone good mental health, and I look forward to seeing you at our next webinar. Take care, everyone.